Good morning, everyone. This is Pratima Penumarthy, founder and president of Volunteering for Seniors, a 501(c)(3) organization. Our mission is to reduce loneliness and isolation among elders and help them stay more energetic. We aim at making sure that senior citizens blend into their communities without any difficulty. And we are achieving this through our meaningful volunteering. Since 2021, we have been conducting a number of VFS virtual webinars, talk shows, and conferences for senior citizens, keynote presentations, general sessions, all that focuses on supporting health, self-care for seniors and caregivers of older adults and individuals, of course, any age with dementia or without dementia. Today's topic is all about Ayurveda and its healing benefits. Ayurveda, as we all know, is an ancient healthcare that has been practiced for many years in India. It's basically a knowledge of life. The things what I know, I just want to share here. And Ayurveda, as we all know, it places great emphasis on prevention and encourages the maintenance of our health through attention in one's life, diet, lifestyle, and much more. Ayurveda is also a life science which teaches us how to live healthy and how we heal illness if one suffers. It's not just a medical process in Ayurveda, but perfect health, as per as Ayurveda, we all know, since childhood we talked about it, we learned about it. It is defined as a balance between body, mind, spirit, and social well-being. So today we have with us Dr. Prathibha Shah. Prathibha Shah is a BMS, MD Ayurveda, MPH, and she's an internationally renowned Ayurveda expert. She's intensely trained in traditional health sciences and as well as a public health. Prathibha Shah distills Eastern wisdom with an understanding of Western principles for the best care of all her clients. She has a strong sense of compassion and empathy, and she has wonderful intent, actual listening skills, in depth. She does thorough assessments, and I'm pretty sure that, if you are her patient, she contemplates into the individualized master wellness plans. She also is very much client-centric, compassionate. Care defines her the best, is the best word I can talk about her. Her pioneering in initiatives in the field of Ayurveda has brought her to the attention to the White House, the Department of Health and Human Services, as well as the Consulate General of India, NYC. For her work, she was nominated in the top 20 women of the year for the year 2014. Plus, I should not forget here that she was also a medical officer with the central government of India in the Ministry of Ayush. And in 2019, she was featured in an international documentary on Ayurveda. Presently, she practices in the greater Boston area. She has clientele throughout the world. So we are very honored to have Dr. Prathibha Shah with us. So Dr. Prathibha Shah, there's a lot to speak with you today. We would, first of all, we would like to welcome you to our show.
Thank you, Pratima. Thank you so much. And congratulations to you for doing this wonderful initiative. Much needed. Thank you for having me.
Thank you, Dr. Prathibha. So very first question, as we know that about Ayurveda, because it's a treatment, and it was, it's based on, the belief that health and wellness depends on, delicate balance between mind, body, and spirit. So can you please describe Ayurveda, of course, in a few words to our audience?
Sure. So Ayurveda is a form of traditional medicine, you can say, in simple words. It is native to India. It originated in the Indian subcontinent about 5,000 plus years ago. It is described as one of the world's most ancient, continuously practiced system of medicine. But I like to call it not just a system of medicine, but a system of life. And that is actually also the literary translation of the word Ayurveda, because Ayurveda is a Sanskrit word, and it's a compound word made up of two individual Sanskrit words, Ayu and Veda. Veda means knowledge or science of, and Ayu means life. So, very simply translated, Ayurveda is that system of life that describes all aspects of life from birth till death. So, it's like in simple words, I can say it's a user manual of life where you can find all of the guidelines how to live in synchrony with nature, outside as well as inside. And there are some key points as some of the things you already mentioned. So, if I were to say, um, if we can think of Ayurveda in terms of three P's, they would be prevention, promotion, and personalization. So, prevention, when I say, I'm talking about primary prevention. So, a big part of Ayurveda is actually focused on primary preventative practices, which fall under, again, you use this very keyword, self care. So, part of the stated goal of Ayurveda actually says, Swasthasya Swasthya Rakshanam, means how can you protect and preserve the health of the healthy? Or let's say you're born with X amount of health. How do you hold on to that? Because that's a very smart and common sense thing to do. And I really, again, at this point, I would like to say that I also describe Ayurveda many times as a common sense science. So, um, primary prevention. So, all of the things that we can do on a daily basis, which fall under what we call dinacharya or daily care routines, and rutucharya or seasonal alignments, seasonal transitions. So, all of these common wisdom, again, common sense practices that were there in all of the ancient cultures, but with modernization, we have become disconnected and we are kind of leading lives that are disconnected with the universe. So that's the primary prevention part. And when I say promotion, we are talking about a very unique concept in Ayurveda, where we talk about making that X amount of health X plus 2 or X square. How can you increase the quotient of health? How can you build on that? And that concept is very unique in Ayurveda, which we call tonics, like brain tonics or liver tonics or heart tonics. So preemptively, proactively, prophylactically, we have protocols that help to kind of, let's say somebody has a history of heart disease in the family. How can you proactively protect your heart? You can bring in some additional health to an area that you will be predisposed to. So that's promotional well-being, and it also includes anti-aging. So it's very relevant to our, sphere of conversation today. Anti-aging or slowing the aging process. So that is the promotion part, and the personalization part is very key. And again, it's a common sense thing because, everything around us, whatever we use, we always try to find out what is the model. Cell phone, what is the model? Laptop, what is the model? Before we start to use it, right? We don't, I have an Android, I can't FaceTime with it. So unless we know what is the model, what can it do, and also what it cannot do very well. And thirdly, what are some of the unique maintenance needs of that model? This is the concept of personalization in Ayurveda. So 5,000 years ago, Ayurveda recognized no two people are alike. And we know that to be a fact today, that everybody has a unique DNA footprint, right? But Ayurveda 5,000 years ago has already stated in all the classic texts that no two people are alike. And there are particular assessment protocols how to determine the body type. And based on the body type, we are able to guide the clients that these are your strengths, ride on them. These are your soft areas, delicate areas, lower thresholds. Look out for them so that you don't develop a disease in that area. And then what are some of the dietary and lifestyle guidelines for your particular body type? So these three P's, I feel, very well describe Ayurveda. Prevention, primary prevention, promotion, and personalization. So I can go on about Ayurveda, but I think this kind of,
This one
in a
is
nutshell, gives you some idea about what Ayurveda is.
sure. That's wonderful. And Dr. Prathibha, how does it, how can we, of course, in your words, explain like how Ayurveda is different from the Western medicine?
Yes. So fundamentally very different. Ayurveda's framework of approach is very different from that of modern medicine. And this is very understandable because Ayurveda developed, evolved 5,000 years ago. The practices at that time were completely different. We were not doing research inside a lab. The nature was the lab. So we are talking of lot of observational studies, lot of data collected from observational studies, and analysis done, and conclusions, derived from those analyses, and protocols developed, and hypotheses developed, and principles developed. So the entire approach was different to healthcare, so to say, and how to live life. And then secondly, again, as I said, the framework, the fundamental framework is very different. So Ayurveda is based on a lot of metaphysical principles. For example, the very key principle in Ayurveda is, it states that the entire universe is made up of 5 fundamental elements: earth, water, fire, air, ether. Ether is nothing but space. So earth, water, fire, air, space, empty space. So it sounds very metaphysical, very conceptual, but the beauty of Ayurveda is that it evolves from metaphysical principles, but then you are able to bring in what we know today under the umbrella of the metaphysical principles. So it's a larger framework, I would say. So that is a big difference. Larger framework, whereas the Western medicine framework is more linear, more limiting, I would say, reductionist. So very narrow in many ways compared to the metaphysical principle approach of Ayurveda. And then Ayurveda utilizes everything that is in the nature. So we are talking about, that is why systems like Ayurveda are called holistic, because systems like Ayurveda use what is there in the universe, what our body can recognize, which is why the stress, the strain from what we experience in Western medicine from chemical drugs, which are a single chemical or a compound, which could be artificially prepared, mostly artificially prepared in the lab, sometimes derived from a plant. But Ayurveda uses everything that is in the nature. So plants, animal products, minerals, etc. Everything is from the nature. And the differentiator here is that our body has evolved in tandem with the nature. So the acceptance of something that is whole and natural is much more. So that is what we call holistic. And then Ayurveda integrates a lot of philosophies in its approach. So we are not just talking about straightforward, you have this chemical deficiency, take it and you'll be fine, or this particular chemical is going to wipe out any bacteria or viruses in your body. It's not that kind of an approach. It's a larger approach of, we are a part of nature, we are a microcosm of the macrocosm. Yat pindi tat brahmande, yat brahmande tat pindi means we are a smaller representation of the universe, and universe is a bigger representation of us. So this philosophy is continuously brought into Ayurvedic approach, which really shapes how we live our life. Because in this kind of an approach, you're never disconnected with the universe. And that is why we have seasonal guidelines, and we are always working in tandem with nature, and in the knowledge of nature. And that includes also the knowledge that our life is finite. From the start of the birth point till the death, we are in a finite time space on this earth. And there is a different kind of an approach to life, not a very attached approach. So a lot of philosophy again comes in, a lot of spirituality comes in. So it's a very grounded, balanced, harmonious approach to health and life. So in a nutshell, these are some of the major differences between Western medicine and Ayurvedic approach. I don't call it medicine because it's much more than medicine. Medicine is just a very small part of it. And if we are to talk about the therapeutic part of it, of the approach, so again, as I said, the first stated goal of Ayurveda is swasthasya swasthya rakshana, means how can we hold on to our health as long as possible. This is a very common sense, smart thing to do. If I have my cell phone, so, the smart thing for me is to continue to do software updates and charge it properly, have a cover. This is called prevention, primary prevention, right? So this is what Ayurveda focuses largely in its first part of the classical texts. That, what are some of the things you can do on a daily basis, like massage and oiling and oil pulling and some activity, some spiritual practices, some meditation. How can you do all of this self-care on an ongoing basis so that you can maintain your gadget as long as possible? And of course, if some trouble comes, then there is an entire pharmacopoeia in Ayurveda. And this part is also very different from the Western medicine approach, because Western medicine is more symptoms management and does nothing to build capacity. In Ayurvedic approach, this is a big differentiator, that there is capacity building, which means that you might be able to actually resolve the issue that you have. And here I want to say that through my MPH, I came to know all these numbers, that a country like US spends more than 18% of its GDP on healthcare, which is twice the amount of any other comparable nation, with worst health outcomes. So there is something to think about this. And most of the disease burden is coming from chronic illnesses. The minute you use the word chronic, means they're all preventable because they're lifestyle related. So this is where a system like Ayurveda can actually is bringing in a lot of value, even though it's not recognized as a medical system in US as yet. But we are trying to bring in the wisdom and the resources and the solutions from Ayurveda to the American public through the health and wellness sector. So these are some of the major differences. Again, this can be a very long topic, but these are some of the primary differences.
But you really projected so many prime points here, Dr. Shah. Also, because our organization, as you also know, we try to help a lot of seniors, and we have a lot of caregivers, family caregivers who take care of the seniors. This is a question which always, we discuss and we talk about it, is what is Ayurveda's perspective on aging?
Very good question. So, as I said, that there is a lot of philosophy involved, and that, it may not seem very important to talk about philosophy here, but actually that is a very strong perspective that Ayurveda brings in, because that itself changes how you're viewing your aging. And so that is something I will let the listeners chew on a little bit, how the philosophy towards life, how the philosophy of knowing how life is finite. It's a circle, everybody has to come and go. So a little bit of detachment is helpful from the philosophical side of things, but to talk about the day-to-day things that aging brings on. So basically, when we are born, we are already programmed for death. Okay. The minute we are born, we are already moving towards our death. I mean, that's a very harsh way of saying it. But the reason I'm bringing it here is that this is a process that starts at birth itself. So we are not talking about a cure for aging or something, although aging is almost like a disease. It's been given the name of disease also in Ayurveda. It's been called Jara Vyadhi, basically. But if you think about what I just said, basically you are running through a graph in your life where there is a little bit of a rise as you grow. You are young in your young years, and then there are degenerative changes that set in with age. So this is something that's already programmed in us. Now, what Ayurveda brings in is this understanding of this phenomenon, a deep understanding. So just to very simply, in a simplified manner, if I can say, Ayurveda divides the lifespan into 3 phases. The first phase is the kapha phase, or the earth water phase, where we are nourishing, we are building, we are growing. Then comes the fire water stage. 0 to 25 is the kapha stage, then 25 to 50 is the pitta, or the fire stage, where you're supposed to get out, you're supposed to have that drive to get out, bring the bread and butter on the table, etc. And then the third phase after 50 is the vata stage, air ether, where you're supposed to degenerate slowly, for the lack of a better word, and then become one with the elements. So the air ether is are the elements that start to dominate after 50 years of age. So I'm introducing this concept to your listeners because once you understand the elemental dominance in this age phase, then it becomes very easy to know what to do to counter them. So air, ether are light and drying elements, right? So, for example, oil, herbal oil, or base oil massages become really helpful after 50 years. So they help with of course, the skin aging also, because they are able to replenish more moisture and oil back into the skin. But also do a deeper impact on the baseline of these elements in the body. So they calm them. So therefore, the degeneration is less. So when you think about degeneration, think about skin degeneration, and then also deeper degeneration where your joints, the synovial fluid, the collagen, and all of the paddings, they start to kind of wear off, right? They start to tear off, they try to start to thin off. So simple oil massages, for example, are recommended. And then a lot of herbs are there that, I can talk about now, or if you have specific questions about maybe like sleep or something, we can talk about that. But yes, so just to conclude on this particular question, Ayurveda has listed or outlined 8 branches 5,000 years ago. And those branches are general medicine, pediatrics, gynecology, toxicology, and geriatrics is one of them. Not just geriatrics, actually, I don't know how many of the listeners know, but geriatrics and gerontology, these are 2 different branches. And when we talk about anti-aging, we are actually talking more about gerontology. So, but anyways, those both fall under Jara Chikitsa. And there's like a huge body of resources and solutions in under that category.
Actually, a part of this question, as you're talking about it, we learned so much today, Dr. Prathibha. But a lot of seniors, which you have seen and I have seen when they talk with us, is they all have difficulty falling asleep because,
Yes.
Your mind cannot shut down, and they keep thinking over everyday activity, generating worry and more anxiety. So,
Yes.
so of course, how will they, within elders, what are the tips that you can give that promote good sleep for seniors?
Yes. Okay. So again, coming back to the air ether element or air space elements, I want everyone who's listening in to this video later on also to imagine air and ether. They're very light elements, right? So what happens, what brings about sleep? Sleep is brought about by earth and water elements. If you think about sleep, your eyes just start to get heavy. So there's nothing light about sleep, right? Sleep is about heaviness. Sleep is about darkness. Nidra kapha tamo bhava. So sleep is a function of kapha, earth, water elements, and tamas, darkness. So actually, when we try to sleep, we switch off lights, we switch off gadgets, we try to create the darkness outside, and we close our eyes to create darkness inside. So why the problem of sleep happens as we start to age is exactly what I said, that the air ether elements start to dominate. So the heaviness that needs to come in for good sleep, that is less, and air ether is higher, if it makes sense. So you're more feeling more awake, or the sleep becomes lighter.
Mhm.
So again, straightforward, very easy, in a simple way, I will say that you have to try and calm these air ether elements. So one thing is the massage, I said. So even if you're not doing the whole body massage, if you can do on the top of the head, which is the crown chakra, you can say, or where your fontanelles are. So this top area basically. And another area which is very potent is the soles of the feet. So foot massage. And this can be done in bed with just a little bit, like a 1 teaspoon of oil with some nice essential oils, lavender or whatever brings in calm to that person. It could be rose, it could be geranium, if you like essential oils. Otherwise, you don't need to, that's optional. But if you do a nice foot massage, and I always say keep some old pair of socks handy. You do not want to be walking with oiled feet, no matter how much you massage in. First of all, don't apply too much, but apply little and rub nicely, because the feet have a lot of nerve endings. It's a very good relaxing ritual that one can have at night time. Then wear socks, and then of course do the sleep hygiene of, having a clean bed and a comfortable bed, darkness, no sounds, all those good things. Those are part of the sleep hygiene. So that's one. And then second is air and ether elements are have cold quality. Just remember this, that they have cold quality, means they're not warm. Fire has warm heating quality, fire element, but air ether are cold elements. Mm-hmm. So for to calm these elements, again, some warm things like a cup of warm milk with nutmeg powder, for example, just half hour before bed or 1 hour before bed is extremely helpful in bringing about gentle, nice, deeper sleep. So a cup of warm milk, and if you're dairy allergic, you can use another type of, non-dairy type of milk, but just that heaviness and that lubrication that the milk brings in is very helpful. And you can add some sweetener as you like, organic maple syrup or organic honey, stevia, agave, whatever you like. So this is very good. And then third thing I would say is, like, in bed, 5 minutes of meditation anytime. And the simplest meditation is belly breathing, where, and listeners can try it. Mm-hmm. You inhale and the belly should come out, and you exhale and the belly should come in. This is called belly breathing, and most of us, this is the correct way of breathing. Most of us don't do it. We all are shallow breathers. So what happens with the belly breathing is that the diaphragm moves down and the lungs expand. And because of the oxygenation, the cortisol levels fall. So any type of anxiety or stressors, they start to dissipate. So you're breathing easier, your heart is not beating hard. And then in this belly breathing, another thing that can be done, which is very helpful, is inhalation and then hold for a count of 3. Hold that breath. So you can try, Pratima. See? And then release the breath slowly. It immediately brings in calm. So whatever anxiety, my bills and my in-laws and my daughter-in-law and my son or my dog or my cat, whatever anxiety starts to kind of dissipate. So that sleep is something that has to be allowed, that has to be facilitated. You can't have a pill for sleep. Of course, there are herbs, which I will not mention on this talk because I generally try to discourage OTC use of herbs, because even they are medicinal. So, but all these things that I mentioned, these can be very, very helpful, simple things, but very beneficial in bringing about good quality of sleep.
It's wonderful. And Dr. Shah, there was a question there was a group discussion where a couple of the seniors were talking about Ayurveda and other herbal holistic approaches. And this was a discussion topic where someone said, like, does it even suit everyone?
Yes. So Ayurveda uses herbs are nothing but plants that grow in nature. So just like all foods may not agree with everyone, I'm not talking about allergies here, I'm not talking about intolerances here, but I'm talking about generally, even if you're healthy, not all kinds of food things will suit everyone. So that much, I would say, variability can be there with the herbs, but if taken under the guidance of someone who is trained, they do their work because they are given in therapeutic amounts, and the amounts can be adjusted up or down depending on how the response is from that particular individual person. So in my 30 plus years of practice, I may have seen different responses where some clients may have needed smaller dosages, but I haven't seen any case where, okay, it did not suit me. So, yeah.
Also, I have one question, like, what does Ayurveda say about high blood pressure?
Ayurveda says something about all of the diseases. It's the Ayurvedic approach that is very, very profound and effective, because hypertension is just a very simple chronic illness, I would say. But if I give you the example of Lyme disease, for example, Lyme disease is something that doesn't even happen in India. And it's endemic to certain regions in the United States, and it has been given a name only recently, like maybe past 2 decades or so. But I have a lot of success with Lyme disease cases, a lot of success, and then with autoimmune diseases, which are all like new, like celiac, Crohn's disease, IBS, arthritis, etc. So the reason I'm bringing that up is that hypertension is still pretty commonly, it has been documented for a long time, historically also. So yes, there are very good solutions for hypertension, and I do have clients who have been able to come off of their Western medicines with the help of Ayurvedic approach, which is not just herbs, it's the full package of food guidelines and lifestyle guidelines, etc. So I hope that answers your question, Pratima, that yes, there is. Yeah.
The reason I asked about high blood pressures at Prathibha is that, a lot of seniors, so most of them have high, and then they're also diabetic. There are combination of so many other health issues, and few of
Yes.
them do have low blood pressure, coming under that concept. And so they are worried because the way they consider is, when you talk about Ayurveda, they think like, oh, we've been always taking certain medicines, which is of course allopathic meds, which they consider that as to be the best one to control. But wanted to know, does it have, like Ayurveda, do they have to take it for a long time to control that, or is there a herb by which, instead of using any particular allopathic medicine, they can use it, or they have to use it in combination with it?
So this is a tricky question to answer on a session like this, because hypertension can be of different degrees. They can be simple, mild hypertension, or it could be quite severe hypertension. And uncontrolled hypertension can lead to a lot of serious outcomes like strokes, etc. So I will try to answer your question as best possible, but I do want to start with the premise that hypertension is something that should not be experimented with to begin with. So whenever I work on any clients who have hypertension, I try to work with their primary care or cardiologist, whoever is their Western medicine provider, so that we are able to kind of collaboratively agree on a weaning off protocol from Western medicine to herbs and diet and lifestyle. So I would say this is certainly not a condition which we can provide any solution through this webinar, because of the seriousness of it, because it can go from just being a mild hypertension to, because one single bleed can lead to really serious consequences. So I would refrain from actually discussing any solutions to hypertension over the webinar. If anybody, and I think I'll come back to the same thing, that both of these are chronic illnesses. So they always have a food and a lifestyle component to it, always. So if I would work with a senior, I would start to give them guidelines on their food, because oftentimes people are completely clueless of how deep a connection is there between their food and their conditions, what they have. And here, one thing I want to say is that when I work with my clients, it's never about, from tomorrow you cannot take this. It's never about that. In fact, so what I send to my clients, I call them master wellness plans. They're pretty detailed, and there's a diet chart and all that. So right on top, I write, if you can follow 60 to 70%, you're good. So it takes only a little shift. I don't even say eliminate this, blah, blah, blah. It's a shift, course correction. That's it. And once you start to course correct and you start to feel better, that becomes a motivation for my programs are very gentle and supportive. Let's put it that way. So I would focus there rather than, share anything like, what can they take, one herb or anything, because this is something you can't do on your own. You have to have oversight. And then I think one of your other questions, which might be coming up, I'll try to answer now, interaction between drugs and herbs. As everybody can appreciate that it's not that every drug and every herb has been studied together, what are their interactions and all that. So this is a sector that is not yet well studied. So there should be caution practiced when introducing any herbs, because if you have a Western antihypertensive, you're introducing an Ayurvedic herb, and now you suddenly brought your client in low blood pressure and they're dizzy. That's something you don't want, because they could be unattended when they're dizzy. So it's a very, very cautious approach. especially with hypertension. Not so much with sugar, because sugar is not that dramatic. It changes over a period of time, so body does get to adjust. And what we do with Ayurveda for diabetes type 2, etc., is to improve the insulin resistance, so works on a deeper level. So, but especially hypertension, and I always say, be very cautious of what you're putting in your body for hypertension. Yeah.
Absolutely.
Yeah.
Also, Prathibha, how can seniors or family caregivers, they find a competent Ayurveda practitioner? Sometimes it's very difficult for them to find. What's the best way for them to find, and how they can find?
So Google, Google is of course fantastic, but there is a National Ayurvedic Medical Association that lists Ayurvedic counselors, practitioners, and doctors like me. So here I really want to convey one thing, that I'm a senior faculty for 2 schools, and I sometimes get clients who say, "Oh, I met this one, and I got Ayurvedic treatment from them before coming to you." And then I realize they are the most elementary level of my students, the health counselors, and they are not even, their scope of practice is not even to even understand disease. So I would like to convey this message through your platform, that please look into the qualifications. It's extremely important. You might find anybody associated with the word Ayurveda, but they might be very basically trained. Like my training is 8.5 years, 5.5 years of bachelor's degree, then 3 years of master's degree, 30 plus years of experience. This is something one must look up, because my basic level of student certification is 600 hours, which is nothing, really nothing. It's basically elements and hot, cold foods and this, that. It's like very, very basic. So look into the qualifications whenever you come across a name in your search. But these are the 2 things I would say: National Ayurvedic Medical Association, NAMA, and I'm also listed there, and Google search, and my own nonprofit, Holistic Health Alliance, where we are also running a directory, and I'm also signed up there, which is a holistic platform, basically. So these are the 3 places I would say. Yeah.
Thank you so much. And Dr. Shah, is there any Ayurvedic treatment for cancer? The reason I'm asking, because we have seen, and most of our caregivers, they have been taking care of family members with cancer. So is there a particular treatment for cancer?
So very complex question, but I'll try my best to answer. First of all, I'm not licensed in this country, so I don't use the word treatment at all.
Oh, yes.
That's one. And then second, cancer is a bucket term. There can be different types of cancer. There could be very slow growing benign cancers, like prostate cancer is very benign, or there could be glioblastoma, which is a very, very aggressive type of very fast. You reach the end very fast. So some types of cancers are very, very severe, I would say, or their outcomes or their prognosis is very poor. So first that. Then second, I like to talk about integrative approach when you talk about cancer. So depending on the type of cancer, if it's prostate cancer, yes, you can certainly try and holistically get your PSA levels in the normal range, etc. For any mid-level to severe type of cancer, what gets impacted a lot is the quality of life. So that is where Ayurveda can bring in a lot of solutions. And I have actually presented in a couple conferences where an integrative approach for patients on chemotherapy. And there are There are scientific papers on the effect of some of these herbs and simple formulations. I'll mention one here, Trifla. You can look up cytoprotective effect of Trifla, where if someone is getting radiation therapy, then how can their normal cells be protected, for example? Or in chemo, all of the side effects of nausea and, just hair fall, anemia, all those things can be helped with Ayurveda. So I would say I look at Ayurveda as a more collaborative form of health and well-being, along with the traditional standard of care for cancer. Again, cancer is a very, it can just be lifestyle related. So sometimes when you hear of people who healed themselves of cancer, right? Who went away, there are so many documentaries on those kind of case studies. So there is a big lifestyle component to it, environmental toxicity, etc. Just removing chemicals from people's lives has a big impact. Or removing stress. People don't realize stress is one of the 21st century's biggest killer. Biggest killer. People don't realize this because it's not tangible. So I would say those kind of insights and transformations Ayurvedic wisdom brings in, fundamental changes, not just I have a growth and how can I destroy that growth, but what brought about that growth? How did it go unchecked in the body? Because body has, we get, it's believed that we get, everybody has cancer tendencies. So we get abnormal cells every day almost, and they get destroyed on a regular basis because the body has the mechanism to sense them, to identify them, and then to destroy them. So clearly some checks and balances not working in the body. So that is where Ayurveda focuses, because Ayurveda and all of the holistic systems, TCM, homeopathy, all of them look at the root cause of the problem. This is a big differentiator, coming back to your earlier question, root cause analysis. And the first step of treatment in Ayurveda is being listed as Nidana Parivarjanam. First step of treatment, even before you give herbs, is remove the causative factor. That's how it's been listed. So it's very, very common sense, very smart, I would say. You can't be sitting on the gas and then saying something is burning me and keep putting water on yourself. I mean, you might not get burned by keep on putting water, but you just can also get up and walk away from the burner, right? So that is what it is, that you remove the root cause while you're working on the bringing relief to the client.
Sure. That really helps a lot. And this is a wonderful explanation you gave, Dr. Shah. Also, I wanted to know, is Ayurveda covered by insurance in US?
So some people have flexi-spend, etc. It really depends on the type of insurance, but because it's not licensed right now, I would say the answer is no. It can. Some people are able to kind of get it under, like some people are allowed to have gym membership or something for their wellness, well-being. Under that, they are able to cover. Some people have done it. I know I have signed off on a few of them, but no, in general, the answer is no, unfortunately. So there are a lot of efforts here and there going on to license Ayurveda.
Hopefully, it will be very nice. Yeah, it will be very good if they get, because a lot of seniors who are in this country, coming from Indian background, they would love it, and they have certain insurances with them, right? And they would love to use that. It would be great, if the policy changes and they can help them, because not everybody are in a position to really
spend out of pocket. Yeah. Yeah.
Also, Dr. Shah, I would love to hear from you some tips, for the well-being for seniors.
So I think
yeah, you did explain, but just trying to run through. Yeah.
Yes. So I'll bring up some of those earlier things that I mentioned, but I'll probably share some do's and don'ts
Yes.
So let me start with the don'ts. So one thing that I have noticed in the West a lot is iced water, especially with food. And it's like you're going to cook on your burner, and just before you started to cook, you poured some cold water on it. So I think what I would like to convey to everybody who's listening is that food gets cooked twice, one on the burner outside and then second time in the burner inside, which is our metabolic system. And that metabolic system is akin to fire. So if you're putting iced water or beverages, sodas, etc., with your food, you're basically extinguishing the burner, and therefore your processing will be impaired. So more and more, even Western medicine is recognizing the centrality of gut health in the overall well-being. Ayurveda has always said that. So what I'm trying to say is protect your gut health, which means protect your fire. And so this is one big thing on top of my list, is removed any iced beverages. Try to have water at room temperature, and try to have small sips of water when you eat, not copious amounts of water, because you don't want to dilute all of those digestive juices just when they're coming there to do their job. Because if your gut is good, your overall health will be 99% good. So take care of your gut. And therefore, in the same vein, I would say, if your elimination is not proper, that is another big sign of slow gut. So consult someone for that. Warm water helps again, because warm water has flushing nature. But sometimes you may need some herbs also to clean up anything that's clogged up. So warm water is another thing I would say in the do's section. And we see in a lot of Asian cultures, there is a culture of having a warm herbal tea along with food, small cups, like in Chinese restaurants and Japanese restaurants, you would have seen. So that is something that is again common sense. You're trying to aid that digestive fire. So protect the digestive fire so that it does not extinguish, and kindle it. So kindle it how? By adding some healthy spices to your food like ginger. So even if you're not an Indian or you're a non-Indian, some shavings of ginger, and even if you're, somebody else is cooking for you, you're in a senior facility where you're being served food, you can always get some fresh ginger and julienne it, or chop it or grate it and just add to your food, and that really helps. Some black pepper, and these are some good igniters of the digestive fire. Turmeric is very helpful. Cumin. So you can look up all of the spices, good spices. I'm not talking about red chili powders, which can be very sharp for a lot of people and more inflammatory in nature. But most of the other spices in small amounts are really helpful to aid digestion. So that is one. And then a big chunk is pay attention to what you're putting in your mouth. And the way the agricultural sector is now in the 21st century, everything is been altered and ridden with chemicals. So clean your source of eating. So pay attention to what way you're bringing it from. What is the source, and is it fresh? Is it seasonal? Is it real? Is it whole? Is it unaltered? Is it unprocessed? Is it unrefined? These are the questions to ask. And some small thumb rules to follow is anything that looks too colorful and is not real, not grown on the ground, like sprinklers or, colors in like food colors, that are added to so many things, cakes, muffins, this, that, to attract you, So avoid those. and anything you can't spell. I think a lot of people would have heard this already. If you can't spell it, don't eat it. And if you see more than 5 ingredients, ingredients on any prepared food, don't eat it. If it's so I always say, like, meat, milk should always be organic, cruelty free, and whole. And eggs should be free range, fish should be wild caught, vegetables, etc., should be seasonal. Corn, soy, very genetically modified, try to get them organic. Dirty dozen, these are small things to follow. Like, I don't know if you have heard of Dirty Dozen, but if you look up Dirty Dozen, those 12 should be bought organic, because they tend to retain a lot of pesticides, like berries, for example. They hold on to the pesticides. So those should be organic. And then portion control, I would say, and a rhythm to your eating. It should not be like, you ate at 9 o'clock one day, and then another day you just skipped it, and there's just no consistency. So that is important. And I also say follow a 3-hour rule, at least 3 hours in between any two intakes, whether it's a snack or a meal or whatever. A lot of people are grazers, so their system does not get time to process things properly. White sugar, avoid. Sodas. So these are some of the things in the do's and don'ts. And some sort of activity. Even if you have a lot of inflammation, try to do some restorative yoga, some Tai Chi. Very careful about not overdoing also. You don't want to cause injuries, but some bending, stretching, moving should be part of the daily practices. So if you follow some of these, do some belly breathing. I like to simplify things for people, that don't try to, I have to go to class, learn meditation. Meditation is not something we do. Meditation is an art of being. Once we understand that, we will not be running behind, I need to do meditation. Meditation is not another thing to do. Mm-hmm. If you can allow yourself to be, that is meditation. So I think these are some of the small little, nuggets, I would say.
Thank you so much, Dr. Shah. You have actually given us a lot of information, not little nuggets. You've given us a lot. And I think from my perspective, I would try to tell all the viewers today that today's talk, I'm pretty sure everyone who's here to listening, we came to know that Ayurveda is a preventive tradition, which means the emphasis is on averting imbalances in the mind and body before they can take hold and cause long-term health issues. So as Dr. Shah was saying, we should think of our body as a river of intelligence. And Ayurveda can always keep things flowing smoothly without obstacles. So Ayurveda gives you a deep realization of the purpose and form of our existence. And it does help, achieve dharma, which is righteousness, which all of us know. And correct me, Dr. Shah, if I'm wrong here, because, this Ayurveda talks about dharma, artha, and kama, which is a cycle of cause and effect. And of course, you get the liberation, which is the most. So it's an excellent path. And if anyone wants to know more about Ayurveda, you can read so much about it. It's an excellent path to transforming one's life, and the enlightenment. And finally, you get the enlightenment of prana, which is a Sanskrit word, which most of us know and may know. It's a prana it's a energy, it's a vital principle, it's a life force. That's all about it. So thank you so much, Dr. Prathibha Shah, for sharing so much information about Ayurveda with all of us. And just wanted to tell all the viewers who are here present today that we at Volunteering for Seniors Organization, we believe very strongly about our relationship-based services, the volunteering services that we are providing for seniors. And that relationship is formed, when between people, that can provide warmth, and it provides companionship, and that helps to all of us, we need it to maintain a high quality of life. And one thing before I end this show, I would love to again tell all the viewers today, because we learned so much from Dr. Shah. And again, from our organization, I would like to say that we are all driven by our passion to add value, as what even today Shah did today, Dr. Shah, that value to the lives of our seniors and help restore, the self-confidence and self-esteem. So this is why, if you have seen, we are putting together various programs to assist the seniors in our community, with their daily chores and other activities that will make them live a life which is more stable and normal. So thank you to Dr. Shah and to all the viewers who have been here today listening to us. And we will be excited if you have any questions to ask about this show, anything on our YouTube, which will be, adding it up in a day or so. And please feel free to share this video. It will be so informative to many people to know more about Ayurveda. So thank you again, Dr. Prathibha Shah.
You're very welcome. It was a pleasure, Pratima. It was a pleasure. Thank you so much.
Thank you.